25 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
Good evening. It is truly fitting that the next honoree received the Dr. Irving Selikoff Lifetime Achievement Award. As a fellow member of the Mount Sinai Mafia, Steve trained under Dr. Selikoff, worked with him, but did something that many of us who worked with him never did. He continued literally the Selikoffian research. Steve kept looking at the insulator cohort that Selikoff had started working with back to the late 50s and early 60s. And so for no other reason, and there are many other reasons, Steve Markowitz should be honored with the Irving Selikoff Award. And not only has he continued to follow that particular group, but it continues in the great tradition of Dr. Selikoff to find ways to take better and better care of people, including his recent work on low-dose CT scanning for the evaluation of asbestos-exposed individuals. So it is my great honor to present to Steve and to all of you Dr. Stephen Markowitz with the Irving Selikoff Lifetime Achievement Award.
Thank you, Arthur, for those words, and also thank you, Linda, and the ADAO for this award. I will continue to try to deserve it. First, I would just want to recognize that my wife is here tonight, Mary Haviland. She has spent the last 40 years fighting violence against women, and for the past 7 years has led an alliance in New York City to end sexual assault. So, as you know, she and the movement have made some progress recently, but we still have a lot of work to do. I started in occupational health about 40 years ago in a little house on Steuben Avenue, working with this young guy named David Michaels. He and I worshiped the Wicked Witch, the head of OSHA at that time, Eula Bingham. And then I later trained with Dr. Selikoff. So to receive this award with David and Eula and others here is really a wonderful thing for me. My goal has been simple: to provide workers with honest, fact-based answers about what has happened to them at work and what they can do going forward to protect their health. The standard I apply is easy. Whatever I would want for myself, for my family, for my friends, that's what I also want for the greater community of workers. Now, you can call that principle by a few names. You can call it basic respect. You can call it a human right. You can call it shared dignity. Or maybe let's just say it's the right thing to do. So we acted on this in the 1980s when we set up a statewide clinic network in New York State so that every worker in New York State within an hour drive could get an honest expert opinion about their medical problems derived from the workplace. That system still exists. Jackie Molina is head of one of those clinics, and it's still unique in the United States. I would call that a human right. We applied the same standard after 9/11 when our center at Queens College, now Queens College is best known for producing elementary school teachers and accountants, but our center set up a mobile unit a block and a half from ground zero in order to be able to see the Latino day laborers. The firefighters had gone off to the fire department, medical department, the construction workers and the utility workers were going up to Mount Sinai, but nobody was paying attention to the day laborers. We documented they had the same problems as the firefighters and the construction workers. And the importance of that work was it provided visibility for that group so that they would become a permanent part of the World Trade Center Health and Compensation Program. I would call that basic respect. And lastly, and let me say, Linda Eula gave me one of her minutes, but lastly, at least for tonight, I am proud that our center at Queens College, which really started with zero activity in occupational health, established the largest medical screening program for any single industry in the country. We've screened 35,000 Department of Energy nuclear weapons workers with the single goal of telling them the truth, which hadn't been told to them before, telling them the truth about how their health had been impacted by DOE exposures. And then, partly as a matter of reparation, we pioneered the use of low-dose CT for lung cancer screening. We've now screened 14,000 workers. We've detected over 100 people with early lung cancer who could undergo surgery and presumably be cured. So thank you. Thank you not just for the recognition of what I and others have done, but really thank you for affirming these values, that basic respect, shared dignity, and doing the right thing are what workers need and deserve. Thank you.